Pregnancy will cause the body to undergo stress-producing changes. Massage can pleasantly and effectively eliminate many of these adverse effects of stress and the accompanying discomforts. Before we begin, let's talk about some of the benefits of massage for the mom-to-be. Massage stimulates glandular secretions, stabilizing her hormonal levels and making their side effects less severe. Massage to the legs can control varicose veins, and the draining effect of massage facilitates reduction of edema or swelling of the extremities. An increase in general circulation offers the rise of blood to all areas of her body, including the placenta. This brings greater nutrition to the tissues of the body and enhances waste product removal. Lazy red blood cells lining the vessel walls are introduced into circulation, thus increasing the red blood cell count. This is of particular importance to those women with anemia. A rise in the red blood cell count also helps to eliminate fatigue, since more oxygen-carrying hemoglobin is released into the bloodstream. The lymphatic system circulates faster and more efficiently. The result is more energy and less fatigue. The strain on the muscles of the lower back, abdomen, and shoulders can be greatly reduced through massage. As mom's pregnancy advances to its final trimester, this relief will be most welcome. Muscle tone can increase from regular massage. Muscle spasms and knots are easily released, with muscles, ligaments, tendons, and joints enjoying greater flexibility. This is most advantageous during labor. Massage sedates the nervous system, producing much-needed rest and relaxation. In utero, the baby feels the same way. Frazzled nerves are lovingly soothed and insomnia can be relieved. Massage accompanies childbirth nearly everywhere in the tribal world. Noted anthropologist George Engelman, who studied tribal customs, wrote in 1884, "There is hardly a people, ancient or modern, that do not in some way resort to massage and expression in labor, even if it be a natural and easy one." Contraindications of massage. There are times during pregnancy when a pregnant woman should not receive a massage. Here are some of the contraindications. When she is having morning sickness, nausea, or vomiting, with any vaginal bleeding or discharge, when she has a fever, when she notices a decrease in fetal movement in a 24-hour period, when she has diarrhea, if she experiences pain in the abdomen, if she notices excessive swelling in her arms or legs. Do not massage directly on top of a bruise or skin irritation. This includes direct massage to keloid scars, those thick, red, ropey scars that might have resulted from a previous C-section or other surgical procedure. Do not massage immediately after eating. Wait at least 2 hours. If her doctor or healthcare provider disapproves for any other medical reason, better yet, do not perform a massage on a pregnant woman unless the physician gives written approval. Before we begin the prenatal massage, let's focus on some of the exercises that you can teach your pregnant client so that she can ease many of the discomforts experienced during pregnancy. The following techniques will also relieve constipation, gas, and heartburn. As the baby grows, so does the pressure on the organs and tissues in the abdomen. The following exercises will help ease a lot of the discomfort and will also help to keep the bladder and intestines empty whenever possible. The first exercise and position is called the pelvic tilt. Have the mother lie on the floor, knees bent, feet pulled up to the buttocks, arms at her side or crossed over her abdomen. Have her slowly lift from the buttocks up the spine to the maximum tilt. Keeping her feet flat on the floor, hold the position for 5 to 10 seconds, breathing normally. Slowly return to the original position, lowering the back first down the spine to the small of the back. Have her take a deep breath, exhale, and this sequence will be repeated 4 more times. The next position is called the 4-point pelvic tilt. This also helps relieve lower back pain. Have the mother kneel on her hands and feet, keeping her back straight. Inhale. Exhale and round out the lower back, bringing her chin to her chest at the same time, holding to a count of 5. Inhale and return to the original position. Do not let her back sway in this position. Repeat 4 more times. The next position is called the knee chest rest. I know it looks a little weird, but it feels wonderful on the low back. First, you have the mother kneel on slightly spread knees. Have her bend her head over and place an ear to the floor. Both arms should rest on the floor next to her legs. Breathe normally. Have her stay like this for 1 full minute. Then turn her head to the other side for another minute. Now we're going to change the position of the pillow and the arms of the client and go into a little bit of a different position to relieve constipation and intestinal gas and heartburn, which are common problems in pregnancy. The high levels of progesterone during pregnancy cause relaxation of smooth muscles and reduced intestinal motility or peristalsis. The presence of the developing baby on the intestines and dietary supplements, especially iron, contribute to constipation and heartburn. Intestinal gas builds up as the waste products remain in the intestines without being eliminated. There are natural ways to alleviate these intestinal problems without resorting to commercial laxatives. Natural papaya juice with digestive enzymes or yogurts with live lactobacillus cultures are some nutritional alternatives. 8 glasses of water a day, small but frequent meals, and high fiber foods such as fruits, vegetables, and whole grains are helpful. Daily exercise will relieve constipation. Walking and swimming are excellent all over body exercises and will promote toning and stimulate peristalsis. The knee to chest position helps to eliminate gas. Now for heartburn, 2 to 3 drops of peppermint oil, rose oil, or sandalwood on the tongue are helpful.
Hello, my name is Pamela Ziske and I am a certified massage therapist, and today we will be performing a prenatal massage on our subject, Kim Colpine. And today we're going to show proper pillow placement for the 3rd trimester. Kim is in her 3rd trimester of pregnancy, so we're going to go over the proper positioning of the pillows that you would use. So you'll notice that Kim has 2 pillows under her head, which would give her proper neck placement for her head and good support for her neck. And then in the front we have a body pillow that we've placed in the front of Kim, a little bit underneath her stomach to support her growing stomach there and between her legs to support her spine and just to provide nurturing for the mother. And also, if you notice in the lower body here in the legs, we have a pillow placed between Kim's knees that will help support her hip and keep her hips in alignment, also to give her good spinal alignment and to also elevate her legs for edema or swelling in the legs.
After warming Kim up with oil, Pam will position herself behind Kim. Placing one hand on top of her shoulder for support, Pam will effleurage from her hip up to and around her shoulder. And she's going to repeat this with increased pressure according to the tolerance of the client. Massage is particularly good for a pregnant woman. It helps with insomnia, morning sickness and nausea. It just feels wonderful for the client. Now we're going to circle all around her shoulder, increasing pressure within her tolerance. Effleurage up and down her neck. Don't be afraid to use a little bit of pressure. It really relieves the tension and stress from carrying around all that extra weight. Now gently squeeze the muscles on the top of her shoulder. With your thumbs, make tiny circles all along the shoulder blade or the scapula. And then make a larger circle all around the shoulder as you did before, using an open hand. And once you feel the muscles relax, you can use more pressure. But remember to always work within the tolerance of the client. Now we're going to move down to the spine. Keeping one hand on her shoulder, make small circles along the spine with your fingertips, working all the way down into the hip. The pressure is toward the spine. Work from the neck down to the hip, and effleurage. Back up from the hip to her neck to complete the movement. Repeat this cycle about 2 or 3 times or until you feel the paraspinal soften. When working on the back, you must not overlook the neck or the hips. You can't release the stress in a muscle group without massaging all the muscles in the group. Support the mother at her shoulder, and with the heel of your palm, make a large circle all the way down into her buttocks. And repeat the same circle on her sacrum. This gives so much relief to the low back. The low back isn't used to handling all the weight from the front, so it does suffer quite a bit. So this feels really good on that low back near the sacrum. And you can repeat these strokes maybe 3-4 times, depending on the stress and tension in the muscles of the low back. You can finish this side with a few more long, fluid effleurage strokes from her hip over into her shoulder. Use your discretion on how many times you should perform this stroke. It's all dependent on the tension in the client. Now we're going to cover her up, and we're going to have her move to her other side, and we're going to remove the pillows carefully and help her turn over. Now, having turned Kim over onto her other side, we will be repeating the same sequence as we did when she was on her previous side. Placing one hand on the top of her shoulder for support, we will be effleuraging from her hip up to and around her shoulder. Always remember to check with the client to see if the pressure is adequate. Now we're going to circle all around her shoulder, increasing pressure within her tolerance. We're going to be effleuraging up and down her neck. You can repeat this as many times as is necessary. Now we're going to gently squeeze the muscles on the top of her shoulder near the traps. With your thumbs, making tiny circles along the border of the shoulder blade. Make a larger circle all around the shoulder as you did before, using an open hand. Once you feel the muscles relax, you can apply more pressure. Going to be moving down into the spine again, and make small circles along the spine with your fingertips, remembering that the pressure is toward the spine. Work from the neck down to the hip with those tiny little circles. Now effleurage